Welcome to another connection here on TKO8 Television. Dennis King, thanks for joining us on the show this week. Each week we come into our Studio B and we have different people and organizations come in to tell us what's going on around our broadcast area. And we have a lot of great organizations and we have a lot of entities that we want to share what they're doing with you. And perhaps you don't know, but there's a lot of activities going on in this part of the country, and we're real fortunate to be here in this community and all the different good things that are going on here. Stay with us. Be back in a moment. We're going to talk with two gentlemen from two different entities, but they're also together with a organization that's been around for 20 years. We'll be back in a moment. Many things have changed over the years, and so has auto body repair. Even though Ozark Auto Body has been in business for over 30 years, they continue to change with the times. They believe protecting the environment is important and have done so by using environmentally friendly waterborne paint from PPG. This aligns with the technology used by original manufacturers and gives you a lifetime limited warranty. Quality PPG waterborne paint, ASC certified personnel, plus 24-hour towing service. Ozark Auto Body in Harrison, always taking pride in excellence.
Crystal clear mountain streams, river rapids, and rolling hills with endless valleys. The beauty of the Ozarks we often take for granted. At Magnus Toyota, we never underestimate the value of our customers. As a third-generation family-owned business, Magnus Toyota has been operating here in the Ozarks for over 50 years. When we make a new deal, we make a new friend. Stop in and visit us today and see why our customers say we're the best. Magnus Toyota, your hometown Toyota dealer on Highway 65 North in Harrison.
Back on Connection here on TKO8 Television. Our first two guests in the studio today, one from North Arkansas College, Dr. Randy Esters, and the other from NARMC, and that is Vince Lease. Thank you both for coming in today. You're looking pretty spiffer here, guys, I must say. You guys get along this well? Did you run together quite often?
You introduced us as gentlemen. We were just looking at each other.
Yeah, there must be someone in the hall you're talking about.
Well, we got to have a little bit of fun when we talk about this kind of stuff. Actually, we come together today, and we have these two people with us. I won't say gentlemen again. Two individuals with us today, and we're going to talk about a very important time frame, 20 years. For NAFE, that's North Arkansas Partnership for Health Education, and it's a joint effort between North Arkansas Regional Medical Center and North Arkansas College. And what a great program it's been for 20 years. I was not here when it first started. I got here shortly thereafter, but the vision and the concept was excellent. And maybe kind of just start off, Randy, and then we'll just kick back and forth here.
Sure. We've been around for 20 years, and we're having a celebration. November 2nd, Vince and I have been working together for several months to put this event together. We're going to leverage it with the business after hours.
Okay.
It's going to be at the Durand Center. We'd like to invite everyone out from 5 to 6:30, again, November 2nd, and there'll be food and some cake, and you can't have anything without food and fellowship. Yeah, a good time will be had by all, but want to invite everybody out on November 2nd for that business after hours and to celebrate our 20th year with NAFE.
Yeah. Vince, if you would, maybe some people, they've heard of NAFE through the years, maybe people moved here, don't really know, just a brief kind of what it means.
Well, it's the North Arkansas Partnership for Health Education, as you mentioned in your intro. What it boils down to, it's the parent organization for our Boone County Health, or Hometown Health Coalition. What it boils down to is that we promote programs to improve the health of the people in this community. We work with the health department, we work with the schools, we work with many organizations, and we work together. We have Dan J. Hawkins, Dr. Dan J. Hawkins did a grant to support the Community Health Resource Center. And there's always been one in the Durand Center, and we've opened one in this last year in the hospital. Mm-hmm. There's a fair amount of educational material that's there. There's a fair amount of assistance for people with some types of prescriptions. So we do a lot of work for folks who really need it, and we're proud of this partnership. And actually what it does is it is a method by which we can work together, because the college and the hospital are partners in a lot of things.
Speaking of the college, we'll go back to you, Dr. Esters. give us a little update. Boy, there's a lot going on. We just talked about a new one that I just got the right on. I guess it's right off the press here. But what's going on at the college? And then we want to get Vince to kind of bring us up to date on NARMC.
Sure, there is a lot happening at the college. We've been getting some national recognition and some state recognition. Our practical nursing program was named the second best in Arkansas. Paramedic program was ranked 3rd in the nation. Rad Tech was 14th in the nation, and there's several others that we were ranked. But one that we're most proud of probably is that we're listed in the 50 most affordable colleges in the nation. So we're really proud about that. We're putting finishing touches on an ambulance simulator. We're going to pair that with our hospital simulation that we have on campus already. We opened that last year. What we can do with that is we can simulate a health crisis or a health scenario, have the ambulance, the folks pick them up in the ambulance, bring them to the simulator for the hospital, and take that patient from when the incident happens to when they're discharged from the hospital. And we can do that, a whole simulation. And even our drama students get involved. They play the patient sometimes. So it's not only is it educational, but it's a lot of fun to see all that come to pass.
Vince, there's a lot of things going on at NARMC. As a matter of fact, you've got some new faces. I keep seeing new faces showing up there, and I know part of the whole thing is the medical talent that you're bringing to NARMC.
Well, we're actively recruiting physicians. We just brought back home Brent Rawson, Dr. Brent Rawson. He's an internal medicine physician. Grew up here, went to school here. Brought back Dr. Ross Halstead. He's a family medicine OB physician who we just had a reception for him recently. We continue to recruit physicians to the market. We've recruited 14 physicians over the last 4 years, and they're all still here working. Right now, the hospital is celebrating a few things. We have just won the Governor's Quality Award for the 2nd year in a row. Yes. This was the highest award given this year, so we were very proud of that. It's actually the 2nd place award, but they didn't give a 1st place, so I'm claiming 1st place. Okay. We're doing a lot of other things at the hospital. We support the college by providing clinical education sites. We want to hire just about every student they produce here. We're doing our darndest to make sure we have the right staff. We were selected as one of the top 100 rural community hospitals in the country. We have done numerous other things that are kind of important to us. And the other thing is that we're going to very soon announce a more Health Grades Awards, which is objective measurement of quality and performance in clinical delivery. We're going to probably highlight our orthopedics program again. So those announcements will come out toward the end of the month here. So we're trying to be the best partner of the community that we can be, trying to provide the highest level care we can right here in our community. And we're trying to grow our physician numbers as quickly as we possibly can, because the physicians are key to developing that healthcare service here.
I know something that a lot of people are anxious and been watching it for some time. You're very close to getting your new ambulance facility started up.
The project that won't finish, is that the one we're talking about? Yeah. Won't be very much longer. We just have to get some asphalt down, then we can move in that program. We do provide an ambulance service to Boone County, Eastern Carroll County, Newton, Searcy, Marion, and we have stations in Lead Hill and Jasper and in Marshall, and we do provide that service for the community. And it's in some areas of the state that's a tax-supported entity, but in our region we're doing it out of the hospital.
You know, one thing that has impressed me through the time frame, I grew up here and moved away for many years and came back, and the improvements. But one of the things that a lot of people notice is the two entities, North Arkansas College and NARMC, and how they work, particularly in the medical field. I'm talking about, you've got premier nursing program, for instance, here, and as Vince was mentioned, obviously, if they can hire those people and keep them locally, you want to do that.
We provide clinical sites for lab, for radiology, for nursing, for the RN and LPN program. So we do partner significantly in providing those folks to the community.
One of the unique things I noticed when I moved here a year ago was a lot of places have people doing things and moving about, but it seems like in Boone County, the hospital, the high school, Harrison school system, and the college all move in the same direction, and we work together more closely, I think, than most other places in the country. So I think that's part of the reason we see a lot of the successes we have that other folks don't see.
Would you both maybe agree the fact that because of the NAFI program that really helped mesh the two entities together through the last 20 years? I mean, because of maybe some things that were started there that maybe didn't necessarily wasn't going in exactly the same as it is now.
Well, I think the program evolved over the years. I think it's being operated in a more sophisticated manner now. Our job is to make sure that our team works together to benefit the community. And I have to say, I work very, very well with Dr. Esters. He is a great hospital supporter, and hopefully we are doing the same thing for the college. Mm-hmm. And the community needs both. Yes. And need both to be very healthy and strong. Mm-hmm. And we're going to work real hard to make that happen.
Well, another thing the people out there in the viewing audience may not realize, but you're talking about two entities as far as employers.
Yep.
I mean, you employ both. I mean, I don't know the exact numbers. What?
About 850 at the hospital.
And what,
about 300.
So, I mean, you're talking about the combined a large number of people that are employed right here locally in the two entities that, again, are working very closely together. Another thing, we got about 3 minutes left. I don't want to miss anything. You got a 50th anniversary coming up, I see, at your tech school.
Yes,
at the North Campus.
It was Twin Lakes Technical College or Vocational College. Mm-hmm. We're celebrating 50 years.
Right.
I'll be doing that, I think, this Thursday.
Okay. Another milestone.
Another milestone.
Yeah. When I was growing up here as a kid, we're not going to get into ages and stuff, but that was the Votech school here. It was North Arkansas College was not here at the time, but it was very popular Votech school for this region, for this area. Put a lot of people into areas of need, technical areas. And of course, it was the Boone County Hospital when I was a kid here. Now it's North Arkansas Regional Medical Center. A lot of good improvements in both facilities. We're real fortunate to have two individuals like yourself at the head of at the helm of these two facilities. But more importantly, to see these two facilities working so closely together in so many different areas, I think it speaks well for both your boards and and the leadership of the two entities here. And anything else? Did we need to cover anything else? I know the NAFI, obviously the celebration of both is very important. Something I did want to mention, and we haven't talked about it much, is your stroke care program here.
Absolutely. We just actually won an award for that program. We were I think there are 31 sites in the state of Arkansas, and we won one of 4 awards and that was for improvement of time to delivery of care. We have patients who come to us with severe ischemic strokes, and we're able to use a medication that's appropriate for that. You can get anywhere in the country that has the program, and we've had some great successes. There are people who have benefited greatly here in the community. And we recently had one situation where from door to what we call needle time or door to treatment time was 41 minutes, and that's after a CT scan, that's after a formal evaluation with a physician, that's after communication with a neurologist over a telemedicine unit, and we did all that in 41 minutes, and that patient did very, very well, almost 100% recovery.
Yeah, and we just got about a minute, but they talk about, when people that have a stroke, it's time is of the essence. Every minute can make a big difference, and I think that's for a rural hospital like we are, to have that and offer it. That's a great program.
Thank you.
Gentlemen, thank you both for coming in. I do appreciate it. Two very good organizations here that work very closely together. We obviously came here today to talk about the 20th anniversary of NAFI, which is North Arkansas Partnership for Health Education. And don't forget, that's November the 2nd, 5 till 6:30 down at the Duran Center. Going to have refreshments. The main thing, show up, show your support for what NAFI has done and what these two organizations are doing for our community, North Arkansas College and North Arkansas Regional Medical Center. Thank you both. Don't stay so long. Stay away so long. Come in and see us once in a while. I mean, you guys can run together once in a while. It's okay.
Well, we were thinking about an online or a TV comedy program if we could run.
Kind of get on YouTube and
we're working on that.
Thank you both. Good luck with the upcoming year, and both organizations keep up the good work, and let's keep our community great. Stay with us. Be back in a moment. We're going to talk with a young lady about something that you don't like to hear about, but it's flu season just around the corner. Stay with us.
We all need the help of a pharmacy from time to time. Sullivan Pharmacy would like to thank all their customers for supporting them as an independent local pharmacy. When you trade with an independent pharmacy, you deal with an owner that supports the local economy and charities. Visit Sullivan Pharmacy for any of your over-the-counter or prescription needs. It's important to keep helping those that help the community. Sullivan Pharmacy, 731 Main Street, Harrison, serving this area since 1965.
Here's another satisfied client from Dental Creations of Harrison.
My husband and I both needed to have dentures. I had looked online and we saw a picture of Wanda, just something about her. I thought this is the place we're going to do. And I called in and spoke with Dave, and he was just tremendous. He answered every single question the first call and told us what our copay would be. It was just an awesome experience.
Dental Creations on the square in Harrison, next to the Big Red Boot.
Back on Connection here on TKO8 Television. Dennis King, thanks for joining me on this week's show. Our next guest in the studio today is from the Boone County Health Unit, Tammy McCutcheon, Administrator. Thank you, Tammy, for coming in. I always say it's good to see you, but it's that time of the year we got to think about the flu, don't we?
Yes, sir.
Boy, it's slipped up on us. It's already, here we are, the first part of October, and well, maybe let's just talk about that a little bit. Basically, flu season is, what do they consider flu season?
Consider usually November through February, sometimes a little bit earlier and sometimes a little bit later,
kind
but usually,
okay,
through that time.
The flu, a lot of people think of the flu, some people think of it, oh, well, it's just like a cold, it's no big deal. Others realize that it's a lot more serious than just having a common cold.
Yes.
Maybe let's just highlight a little bit, why should you get a flu shot? What's
well, to protect yourself against the flu, protect your loved ones, the people around you, the vulnerable people around you. It's just a good.
It's something. It's when we talk about preventive medicine.
Yes.
It's preventive medicine, just
yes,
like
it is.
anything else. Symptoms. How do you know if you've got the flu versus just a cold?
Some of the symptoms are, but are not limited to fever, sore throat, cough. Runny, stuffy nose, muscle and body aches. The symptoms of the fever usually comes on very quickly with the flu.
Is there any, I guess, time frame? Does it vary by individual? I mean, how long does the flu usually last? Does it vary if you've had the vaccine?
It just depends on how worse the case is, how long it lasts. Some people can get over it quickly, and some takes a little bit longer.
Takes longer.
Yeah.
I would think that people out there, and we want to get into that a little bit too, particularly people that have a low immune system, it's really susceptible to that.
Yeah, people with chronic health conditions such as heart disease, lung disease, cancer, asthma, arthritis, anybody like that has a chronic health disease. That's one of the high priority people that we would want to get vaccinated.
Children. What about children?
We give flu vaccine anywhere from 6 months of age up. Children are around, lots of other kids in schools, in closed-in areas. So they're a high risk.
There's been I won't use the word negative publicity, but there's been some adversity as far as who should get their child vaccinated, who should not. Are they still unclear as to the safeness, I guess, of the vaccine? Is some people still kind of up in the air?
Not so much as what it used to be.
Okay.
They're more educated.
Yes.
Lots of physicians and pharmacies are giving the flu vaccine, the health department. So the word's getting out more, and people are more educated on the safe of the flu vaccine.
Yeah, because there was a while there that it was, I won't say getting a bad rap, but there was concerns by people, and obviously good concerns, that particularly young children, parents want, should I have the child get the vaccine or not? What's the effects of it on the, they were having some, but as you mentioned, much more educated. I haven't heard anything the last couple of years much about it at all.
No,
really.
We haven't heard any bad, negative things about the flu vaccine. So
I know you do the mass flu clinic. that's coming up. We want to talk about the date in a minute. But there also is, what about the nasal spray stuff?
We're not doing the nasal spray this
Okay.
year. The flu vaccine is the most effective for the flu, so we're not going to do the nasal this year.
What was the rationale between having the two available? I'm sure it still is. Was there any up or downside to the nasal spray?
The nasal spray course is easier on the kids.
Okay.
It is live versus the vaccine is a dead vaccine.
Right.
So there's a little bit more precautions with the nasal. So maybe it was just a preference, really, for the parent.
Just give them an option.
Yeah.
Gotcha.
But there is an option any longer. It's just now the flu, the shot.
Okay. The flu virus, it varies, I know, from year to year, different strains, or I hope I'm saying that correctly. But how do they start the year before, I guess, trying to determine how to guess?
They do. The scientists start the year before on the strains that were then, and then they decide which would be best for the strains that are going to happen for this year. So there's a lot of scientific research in with what vaccine is used to protect people against the flu.
I would assume, and we talk about different classes of people. Obviously, Tammy mentioned that elderly people or people that maybe have their immune systems are affected by whatever different medicines or a disease or whatever. But probably as much as any is these kids going to school. Now, you can spread it around pretty fast.
Definitely. We will be going to all the Boone County schools starting, I believe, tomorrow. We'll be going to Alpena, will be the first school.
Okay.
The parents need to be on the lookout for consent forms that come home with their child and the information about when the clinic is.
Okay.
We ask that those consent forms are signed and sent back with the child, because we will not be able to give the flu vaccine to a child without that consent form signed. Yeah.
So do you, does the health unit, Boone County Health Unit, do you go to all the schools in Boone County?
Yes, sir.
So
Yes,
you have
we
a
do.
schedule
Yeah.
for them?
We try to get them all done in October, so we're really busy during
ahead
that
of the
time.
ahead
Yes.
of the flu season, so
Yeah.
to speak. So the best way, obviously, to we won't say stop it completely, but the more people that get vaccines, so that you're hopefully not spreading the virus, the better off we are. Is
Yes.
that?
Some of the best ways to keep from getting flu: wash your hands with soap and water often. If you use a good hand sanitizer if you can't wash them. Get the flu vaccine.
Yes.
If you're sick, stay at home so you don't spread it. We tell people to cough into their elbow instead of in their hand.
Yes.
So just things like that.
Yeah, just some common sense
Yes.
stuff sometimes. But you do you see particularly a lot of, because the kids don't do just what you said to do. They don't always like to wash their hands.
Sure.
They don't always cover their mouth. So a lot of the viruses, the flu viruses in these communities, probably escalate, if you will, through the public side of it, which would be schools and,
Yes.
and that kind of
Yeah.
stuff, and that you would see. The mass flu clinic. Let's talk about when are you doing for this area?
Yeah, that'll be this Friday, October the 6th, and we'll be at the Eagle Heights Baptist Church. The hours will be from 8 to 5:30. Just walk in, get your flu shot, and walk out. It's pretty quick, 10, 15 minutes maybe. Some things that we ask you to bring are an ID, driver's license. If you have private insurance, bring that card. If you have Medicaid, Medicare, bring those cards with you. And if you don't have any of those resources, we'll be providing the flu vaccine to you for free at that day at the Mass.
Okay. So, obviously it's important from a financial standpoint if people do have insurance of some type or Medicare or whatever, that they, you want to utilize those
Yes.
if you can, rather than just the free side of it. But the main thing is they don't turn anybody down. If you want to
Definitely not.
if you want to get the vaccine, you can be there. Is this something that the Boone County Health Unit is something that you do every year? Has it been going on for a long time?
Yeah, I've worked at the health department for 28 years now, and we've had a mass flu clinic for
Every-
that long and probably longer, actually.
Really?
So,
Wow.
yeah. Yeah.
Has there been, through the years, has there ever been a situation where nationally across the country where the flu really kind of got a hold before the vaccines? I'm sure up and down through the years.
Maybe some up and down. Usually we're always ahead of it a little bit. You do hear of a few cases before you actually start giving the flu vaccine sometimes.
Right.
We haven't heard a lot this year so far, so hopefully we're right on track.
I assume, is this your vaccine? Do you get that through the CDC, or where's that?
Yeah, through CDC in Little Rock.
In
yes.
Little Rock, okay.
Yeah.
So what you're, I asked this before the show. I said, so is there going to be plenty of vaccines this year? And you said, looks like there's going to be a good supply.
Yes.
And then, of course, people always wonder, okay, well, I hear about they've got a vaccine, but then you hear 2 months later, well, the vaccine really wasn't for that strain, it was for another strain. Regardless, you still recommend to get the shot because it can reduce the symptoms and
Definitely,
so forth. Yeah,
definitely
keep
get the
people.
shot, yeah.
But I guess that's kind of a guessing game for the scientists.
It
isn't
is.
it?
Sometimes, they do a lot of research the year before to find out what strains was in the flu that year, and then they try to match what would be coming or what was in it. So there's a lot of research that goes into the flu vaccine.
We got about 3 minutes, so and then I'll bring up this date again. At the health unit, the Boone County Health. What are just a few things? We're going to get off track. What are some of the things that you do at the health unit for people if they might not even know what you do?
Sure, we have lots of programs at the health department. We give immunizations, of course, the flu vaccine, and then all the childhood immunizations that they need for schools.
Okay.
We have a maternity program where we see maternity patients. Family planning is our birth control program.
Right.
Girls can come in for exams. WIC is for women, infants, and children.
Okay.
It's a supplemental food program where they can get vouchers to go to the grocery store for food items. We have environmental health specialists there that go out and keep all the restaurants clean and up to date on policies and things like that. So, yeah, there's lots of things that we do at the health department that some people don't know about.
Well, that's why I wanted to bring that up, because I'd kind of forgotten all the different things. Actually, I'd forgotten the fact that you have the inspectors that go out and check restaurants and food purveyors.
And any septic systems that are put in, whether residential or commercial, they have to inspect those and make sure that they're by policy and
throughout
guidelines.
the county,
yes,
I guess.
Yes.
Throughout Boone County. Okay,
yeah.
Very good. So I didn't know that. Well, I'm glad I asked you that question, because I know you do a lot. You do a lot more than flu vaccine.
Yeah, we do.
Well, Tammy, thank you. I appreciate you coming in as always. I always think of Tammy this time of the year, not because she's just involved in the flu, but it's important that people understand that you really should get the flu vaccine if you can, and the Mass Clinic is a great time to do it. Mark your calendar, because if you live in Boone County in this area, October the 6th from 8 a.m. until 5:30 p.m. at the Eagle Heights Baptist Church, and it's easy to find, and they're well organized. They have people parking cars, they have people lined up as you go in, and don't forget to take your insurance card, your Medicare, any type of card that you may have for help in this. But if you don't have any of those and you can't afford it, it's free of charge. They just want to make sure everybody that possibly can get there, that they go in to do it. We've got about a minute. If they miss it, where can they go?
Sure, if they miss the Mass Clinic, we'll be giving them at the health department. Our hours are 8 to 4:30, Monday through Friday. You do not have to have an appointment to get a flu vaccine. Again, if you have insurance or Medicaid or Medicare, bring that with you. Now, after Mass, if you come into the health department, there is a $30 charge.
If you don't have
those resources. We won't not give you a flu shot for inability to pay, but that's just what we do. But yeah, we're hoping everybody can get to the Mass to get that done.
Do that first. Tammy, again, thank you so much. Always look forward to seeing you each year, and it's good information and great work that you guys do out there, and what a service they perform for our community. Don't forget about the Boone County Health Unit. Thanks for joining us on our Connection Show this week. We hope you got some information perhaps you didn't know about, and we do appreciate you joining us each week as we bring in different individuals to talk about what should be important to you in our broadcast area. See you again next time on the Connection Show.